everybody. Welcome. Is that really loud? Okay, good, perfect. Welcome to our first community conversation of 2026. My name is Ted Burton. I'm Chief Communications Officer for Central Health. We're really glad that you all are here with us. Thanks to those of you who fought the traffic to get here. We imagine some folks may be trickling in. If you don't know the why, you probably do now. Anyone who lives in this area, I grew up in this area, it's been a long, extended nightmare, but it's getting better. So quick housekeeping. Hopefully you have helped yourself to a meal. If not, there's food there. We don't want to take any leftovers home. So please, if you have hungry kids, spouses, friends, neighbors, maybe a dog, help yourself to some food before you leave. I also want to quickly give a special shout out to Constable Suits. Where is he? There he's hiding. Always hiding, not really. It was a year ago at this community conversation that the constable offered to help us secure a location for this year. So thank you for your effort and your time. We really are grateful to be here and appreciate you very, very much. So without further ado, I'm going to introduce our first speaker presenter. We have several presentations for you, and then we really want to hear from you. You may have seen the button. Hopefully you grabbed a button. If not, we have more. This is the year of access for 2026. You being here is helping us expand healthcare in Travis County, and it means that you really care. So we are grateful for your time on this Wednesday evening. And with that, I would like to introduce one of our Board of Managers, our Treasurer, Dr. Maram Musaitov.
Well, good evening, everyone. I hope you're all doing well. Thank you so much for being here this evening for our first community conversation. We are excited to learn and hear from you all, and that's really why we're here. It's to listen. So please allow us the opportunity to listen to your needs and to see how we can address them in light of all the challenges we have. One of our main challenges, funding, as we all know, across the board, everyone is suffering, but our main mission is to provide care for those who need it most, and we are really dedicated to do that work. I just want to also acknowledge my fellow board members, Manager Amit Matwani, our Vice Chair, Manager Elisa May, and our newest board member, Sedora. Welcome all, and also our CUC board members who are here as well. Thank you for being here. I see Maggie. Do we have others present? And also our Sendero board members as well. Thank you for your service and for the work you do for our community and for Central Texas, especially those who need the care mostly. I also want to acknowledge really a point here for our community. I know we are really dealing with unfortunate circumstances, what happened over the weekend on 6th Street. So our heart goes out to all the families who were impacted. And I'm glad that we were able to, we have our first responders who thank you so much for the work that you have done in your team, really for being there at a really critical moment. Again, thank you all for being here, and we really want to hear from you to see how we can help and support, and that is really it. And I would have the greatest honor of welcoming our great commissioner, dear Ann Howard, and really thanking her for her dedication and work, especially for those who are our unhoused population, for your dedication. Thank you, Commissioner. Welcome. Thank you.
Thank you so much, and thanks to everyone who braved the traffic and the heat. It's March and it's hot, so I'm afraid we're in a little trouble over that. I too want to thank Stacy Suits, our constable. He was one of the first persons I met when I was campaigning for this office, because this is our precinct. He's the Precinct 3 constable. I'm the Precinct 3 county commissioner. And we also have Ed Scruggs here, who's representing City Council member Paige Ellis, and this is her district. So thank you to Ed for being here. Wow, Travis County is really big, and you experienced that to all the staff who drove over here from downtown or east or, north. Thank you for making the trip. And the board members, I told someone I've had 2 new sets of tires, and I've only been doing this 5 years. It's just a lot of driving. But what a privilege to try to help meet the needs of people. And it's just, I wake up every day, with honor and privilege to do the work. So I'm glad I'm here. I could talk all evening. Hi, Chuck. But I'm not. But I do have a few things I want to just sort of set the stage for you about why are you in a county building? Why is Central Health going to the 4 areas of Travis County? And, Travis County is sort of the low rung of the state constitution. The state sets up the counties. Anybody know how many counties are in Texas? 250. You're the second group I've asked, and they know the answer. I'm so impressed. 254 counties. We're a big one. We're 1,000 square miles. And, so it's big, right? And we have responsibilities, and we have goals. And our jobs are to keep people safe. We've got the sheriff's office. We contract with EMS to cover the county. We have the constables and corrections. We run the courts. Yesterday was a great day in Travis County. We had record voters turnout, and it was smooth. It was smooth. And part of that emergency, we do EMS, we've got all the fire stations out here. Everybody pays taxes to the county. If you're a property owner, you pay taxes to an emergency service district. If you're like me, you pay to 2 of them. There's a lot of connection between our day-to-day life and our county. If you live in the city, you also live in the county. Some people don't live in a city. They're just in a county, but all Texans live in a county, okay? There's a few other things the county does that's interesting. The county has a relationship with Central Health. That's how Central Health, which is a prettier name from the hospital, taxing district, but you also pay taxes to Central Health to provide health care, to provide access to hospital care. And so there's a connection, and the county, I didn't know this when I became a county commissioner, we have to approve the Central Health budget. We have to approve their financial policies. She's getting into me. And we have to approve their real estate purchases or transactions. So there's a connection, and I'm happy to say it's a growing partnership. We're working much closer together. I'd been bugging Central Health for about 10 years before I got elected as the county commissioner because of my work on homelessness. I'd been bugging Central Health to get more health care to the street, to the people, to get it out to the people. And I'm very proud to say they're doing that. And so I want you to know that if there's something really good that's going on about Central Health, tell me, and I'll brag on them. If you have a concern, that's why we're here tonight. We want to hear from you. So you can also tell me your concerns. This building, I want to not be remiss. It was Stacy's idea, I think, that we hold these meetings here. And this is the home to not only Constable Suits' office, but our Justice of the Peace, Sylvia Holmes, to a community care clinic, to Travis County Community Center, to some senior programs, to a WIC program, and to a beloved tax office. So there's a lot going on here. The last touch point I wanted to add was that Central Health did some data work for us and looked at this sort of as a focus area, Oak Hill. my precinct, I love Oak Hill. There are 17,000 residents that, I don't know how y'all name Oak Hill, I guess it's some zip codes, in the Oak Hill area. There are 469 families living in poverty. It's 11%. Only 7% of Travis County writ large qualifies as living in poverty. That's important for me to know. It's important for Chuck right here to know. He's our emergency services executive. Because a lot of times, people think the West Side doesn't have any problems. The West Side doesn't need anything. And it's my job to advocate for the West Side because we have families in great need. So I'm glad you're all here. I'm looking forward to listening to you and learning with you, and then holding Central Health accountable to what we heard. So thanks for coming.
All right, so good evening, everybody. I'm Dr. Pat Lee. I'm the President and CEO of Central Health. Thank you so much, Constable Suits. Thank you so much, Commissioner Howard, for hosting us tonight. I want to add a few welcomes and thank yous to a number of special guests tonight. So, Commander Selena Shia, thank you for being with us tonight. Ed Scruggs for Councilmember Ellis, thank you for being here. I know we've called out our board members, but I'll do it again. Central Health Board Managers, Vice Chair Lisa May, Sadora Jefferson, Treasurer Dr. Muhammad Saiti, who you saw earlier, Manager Amit Malwani, who is also on the board of directors for Sendero, together with Carol DeVos and Maggie Sains. Thank you for being here from the Community Care Board. We also have two community health champions, Sam and Trisha, here with us. Did I miss any community health champions in the room? Lucas? Yeah, sweet. All right. And yes, perfect. Please remind me your name. Guillermo. Perfect. Thank you for being here with us, and thank you for being part of that wonderful network. All right. And thank you, above all, for taking the time to be here tonight. It's not easy to make your way out on a Wednesday night. And like Commissioner Howard said, please know how much we know your voice matters for shaping the future of the public health system, and we really appreciate you being here. So I want to kick off our conversation tonight with a question for all of you. When was the last time you can recall experiencing really great customer service, really great customer service? Maybe this was an amazing restaurant, maybe a really great boutique hotel, maybe you were at HEB. Now ask yourself this: has healthcare ever really felt that way for you? Has seeing a doctor ever felt easy? Has that whole experience really felt like it was designed with you, the patient, at the center? And I'm going to guess probably not, because for most people, healthcare often feels fragmented and confusing. Call this number, wait for this appointment, fill out these forms, and repeat your story again and again. Well, tonight, my colleagues, Sharon Alvis, CEO of Sendero Health Plans, Dr. Nick Yagoda, CEO of Community Health Care Health Centers, and I want to show you and share with you how Central Health is building something different. We are focused on creating a single, seamless, and coordinated experience of care that is centered on you, the patient. So let me back up a moment and tell you a little bit about who you are. Next slide, please. And you have an infographic on your seat as well, if it's easier to follow along. So Central Health provides 3 core services for our patients and our community. First off, we offer affordable health care coverage. Central Health works hard to make affordable coverage possible for every member of our community, especially people with low income. Coverage is a hugely important part of our community because we know that it is the doorway to health care. It allows people to see a doctor, to manage chronic conditions, and to get ahead of problems early. And my colleague Sharon will share more about the coverage options available in the Central Health system shortly. Which leads me to our second service, which is high quality primary and specialty care that happens outside of a hospital. CommUnityCare's clinics, with their amazing primary care network, are at the heart of this work, and we also now offer a wide array of specialty care services. Things you might recognize like cardiology and pulmonology for your heart and lungs, all the way through to dental, mental health care for your teeth and your overall mental emotional health, and everything in between. My colleague, Dr. Yagoda, will share more about all these services we provide shortly. Now, if everything is going right, this is where most of the care should happen. The better a job we do with this part of our care, the more seamless it is, the easier it is to access, the less patients will need to use the hospital. Which, of course, brings me to the third piece of our work, hospital and post-hospital recovery services. When people do need to go to the hospital, we make sure they receive the right care in the right setting at the right time, and that they are safe and supported as they leave that hospital through our recovery care services, our transitions of care services. If they're experiencing homelessness, then our medical respite care services. No matter where any one of our patients is on their journey, we want to make sure that their care feels seamless, compassionate, and high quality. Next slide, please. We serve a lot of patients in our community using this approach. This year, our central health system is on track to serve 1 in 6 Travis County residents, over 200,000 people. And over the last few years, we've made meaningful progress delivering care in historically underserved areas of our community. We still have a lot of work to do to reach everyone who needs us, and over the next decade, we're aiming to double the number of people who we serve. This is part of our dual vision, to provide high-quality, affordable care for our community members who need it, while providing the highest possible return on investment to our taxpayers who help fund this work. Let me break down that first part, providing high-quality care. At Central Health, high-quality care means whole-person care, care that is tailored to the individual patient. This is what we call one-size-fits-one, not one-size-fits-all. It means coordinating all of the care a person needs to thrive. That could be physical care, mental health care, dental care, could be nutrition or housing support. Everything that impacts that individual's ability to live healthy. And because Central Health is a public system that's accountable to our patients and our taxpayers, and not necessarily to private shareholders or the market, we can design our care around the real people and their real lives, and not necessarily around the institutions solely who provide that care. And this is an unusual approach to healthcare. It's not just better for our patients' well-being, it also saves us all a lot of money. And so that brings me to the second part of our vision, providing the highest possible return on investment for the taxpayers who help fund our work. Because of historically inequitable policies, even today, people who live west of I-35, and some of the folks potentially here in Precinct 3, live 10 to 20 years less than folks who live west of the highway in the more affluent neighborhoods of our county. And the cost of that is actually very high. Anyone want to guess the estimated cost of those disparities in life expectancy and health each year? It's over $1.1 billion every year right here in Travis County. It is expensive to let these kinds of health disparities persist. And that's a low-end estimate, but let me break down where that number comes from. First, it accounts for the cost of preventable, emergency, and specialized care. This is expensive care that could have been avoided if we had just gotten ahead of those problems early. We had caught that cancer and cured it at stage 1 rather than waited for it to be metastatic at stage 4. We treated that hypertension and diabetes instead of allowing that stroke, that debilitating and devastating stroke, to occur. It's a lot less expensive to prevent that problem than to let it go unmanaged. The second way that $1 billion adds up is through lost productivity. There's the economic loss that we take on when people are so sick they can't work, or when a family member must take leave to care for their loved ones. And the third, of course, part of that component is the premature death, years of life and economic value lost too soon. Now, it's important to recognize that as taxpayers, we pay these costs whether we intervene early or not. There is no free lunch. The real question for us is to ask, do we want to continue paying more for crisis and emergency care that we failed to prevent, or do we want to invest our funds earlier and more wisely in preventive care? At Central Health, we believe that investing upstream is both the option that reduces the most suffering for our patients, it's the right thing to do, and the option that adds the most value by reducing that $1.1 billion of economic impact on our taxpayers. This is how we reduce that unnecessary cost while providing whole person tailored care for everyone in our community. So at this point, I'd love to pass over to my colleague Sharon Elvis, CEO of Sendero Health Plans, to talk us a little more about the health coverage options available here in Travis County. So Sharon, over to you. Thank you.
Well, thank you all for being here, and thank you, Pat. We really do appreciate you all coming to hear the story. Sendero is the payer portion of the description that Pat gives of the local payer provider public system, and we are a licensed HMO, licensed in Texas. We are a community based. We're a nonprofit, and we work within the individual market, the ACA marketplace, and so we have actually seen incredible increase in our volumes within Sendero. In 2023, we were about 6,000 members, and in 2024, we were at 12,000 plus, and in 2025, we went to close to 25,000. And we've seen incredible increase again this year, so we're very pleased with that. We're working in the ACA market and serving that group of the population. We also work very closely with Central Health, and Central Health has the medical access program, that what we call the MAP program, and that serves members who have an income of an individual below $32,000 a year, or if it's a family of four, it's $66,000 a year, and they're enrolled, and they can't qualify for Medicare or Medicaid. They must live in Travis County, but we provide the MAP program from them, and they're enrolled in medical services. And there's about 37,000 members in the Travis County community that are enrolled in that program. We also have what we refer to as MAP Basic, and these are individuals who fall below 200% of the federal poverty level, and there's another 63,000 of them. So we're serving roughly 100,000 members within Travis County within the MAP program, and those numbers have grown in recent years as well as we continue to expand that coverage in the process. We also have something we call the CHAP program, and this is where Sendero works very closely with Central Health, and we identify members who have critical needs that can't necessarily be served within the capabilities, the service levels that MAP can provide. I'm talking bone marrow transplants. I'm talking patients who really have critical needs on long-term dialysis, that level of patient. We bring those patients under a Sendero plan, and we work very closely and are able to provide greater services to the MAP members than we were able to before. And of course, Central Health funds those premiums for those members, so that we provide greater care than they would possibly otherwise be able to have within Travis County. We also partner with local groups. So one of our most important popular programs that we have is with HAM. That's the Health Alliance for Austin Musicians, and I'm getting thanks. Thank you. You're welcome. It's a wonderful program. We work really closely with HAM, and again, they end up purchasing an ACA plan on the individual market, and then Central Health steps up and helps support the premiums over and above what they receive in tax credits. We have about 1,500 members in that right now, and that includes their families are also allowed to enroll. So we really feel like it's a great program. It supports the whole Travis County initiative, the Keep Austin Weird, and our musicians, and so we really like participating in that. We also have recently put together a program working with the restaurant workers, and we have a pilot project to see if we can assist the restaurant workers within the community with a similar program. That's also tends to be a group of patients who don't have a lot of access to health care coverage. And this is a way for them to try and see if we can figure out a way to do that. Sendero has a lot of other capabilities and things that we provide. We work closely with within our own organization. We have TPA services, third-party administrative services, and we are going to be reaching out to serve area employers and probably helping the nonprofits is who the first group will see if we can assist with coverage for theirs. Coverage is a huge problem. And we all know that without coverage, people do not seek care. Even if they know they can, because if you don't have coverage, it's embarrassing to walk in and be asked for pay when you don't feel like you're in a position to do it. So we believe within Central Health and in Sendero and in CUC that bringing that together is really an incredible issue. We believe, I mean, this is a really difficult number to wrap our hands around, but we believe there are about 160,000 people within Travis County who have no insurance, completely uninsured. And we think that group, we think about 30,000 of those are children. And some of these may qualify for a program. They may or may not. The children may be able to get into a CHIP program or one of the Medicaid products, but the knowledge is not out there. They don't know how to do it. And so our efforts and our initiative is to reach out and see if we can't help them, identify them. And so we're working closer together than we ever have before. I think it's one thing that I would like to speak to that Pat has so eloquently referenced here. There really is a unique change within Central Health over the last several years. Nick is relatively new to his role as CEO of CUC. Pat is relatively new to his role as the Central Health CEO, and I'm relatively new to my role as the CEO. I've probably been here longer than the other two, but we have really come together. And this is an organization that positions Central Health as a hospital district to be really unique. And part of it has to do with a lot of what Nick has, because having the federally qualified health clinics, having the health clinics as part of this is not typical in a lot of hospital districts. They're built around hospitals. We have the availability, the access to what the FQHC brings to the table. And so it's a really unique opportunity to build what Pat described as that process of picking the patient up on the early end. How do we get them through the process so they don't end up needing a transplant in my program or being on long-term dialysis? So it's with that, I think that's an appropriate time for me to turn this over to Nick and let Nick tell you more about his program.
Thanks, Sharon. Good evening, everyone. I'm Nick Yagoda. I am the CEO of CommUnityCare and also the Executive Vice President of Ambulatory Services for Central Health. When we say ambulatory, just think not in the hospital and not requiring overnight stays. I want to talk to you about our expansion of access to care. This has been our year of access that collectively we as a system have come together and said that is our focus. It's been blessed from the boards down to the front line, and everyone's focus is on increasing access. And I will ask of us, what is access? It is a concept that is sometimes hard to hold on to, but we can think of it in many different ways, and we should think of it in many different ways. We've talked about a couple of them already. Sharon referenced the notion that if you don't have coverage, do you have access to care? Well, yes, as a health center, we will see you. In fact, we are obligated by the federal government to see you without regard to your ability to pay. That is not enough. There are still some who will not come into a clinic for fear that they will not be able to pay for the services that they receive. Access may also be, I need something today. I call. I wait on the phone, and I'm given an option finally to see someone 2 months from now. That is a delay in care. Access could be, I need a particular type of procedure or a particular type of doctor, say a neurologist or a podiatrist, and there aren't any in town. My delay in care is extended. So when we think about access, one of the ways that we can think most viscerally is, can we minimize the delay to getting your needs met? And so we're thinking about this comprehensively as a system, and I'll go through a couple of systems for this. First, if we could go to the next slide, I'm going to give a snapshot of what CommUnityCare does in order to provide that access. Every year for the last 10-plus years, CommUnityCare has continued to grow inside to try and meet the demand of the community. Right now, we serve nearly 150,000 unique patients each year. That's usually between a 7% and 5 to 7% growth year over year. Each and every one of those patients, with the exception of a very few, are considered low income. And when we talk about low income, Sharon mentioned this, that is a family of 4 living on $66,000 a year. And in a city like Austin, where we know the affordability has been challenged again and again, that is very hard to make ends meet at that level. More than a quarter of those are on Medicaid, and those principally are children and pregnant women. And almost 2/3 of them prefer a language other than English. Fortunately, our staff also speak multiple different languages, and when we don't speak any one of those particular languages naturally, we have interpreter services that make universal language access universal for all of our patients. If we could go to the next slide, please. This shows a bit of the growth over those last couple of years. We are still not meeting the demand of this precinct or any of the other 4. We know that, but we have been working diligently to try and increase access year over year. You will see the bottom line reflects our growth in the raw number of individuals we've seen. I mentioned we're at about 150,000 per year. The actual number of visits that translates into is more than 500,000 visits. I'm thrilled that we are doing it in this location. The clinic upstairs, for those who live in the community, is a beautiful place to come get your care. I've worked there many, many times before. There are so many different types of services that we offer within CommUnityCare, not only primary care, but also specialty, behavioral health, dental, and many, many more, complemented even further by the level of access that Central Health is starting to produce through its specialty clinics scattered at various places around the city as well. This is a growth that is continuing to accelerate year over year, recognizing we still do not have the level of access that we need. If we could go to the next slide, please. This is an example of Central Health's growth. Last year, they opened a whopping 14 different service lines in 2024, nearly 6,000 visits. The next year exceeded even that to 23 actual specialty clinics. This business has been an extraordinary type of growth, one that we might think of as in the vein of those startups in Silicon Valley who overnight grew so rapidly. This is the same type of growth because the community told us what you needed. And we saw that the need was so severe, we decided we can no longer contract for this service. We have to start providing it directly ourselves. And the growth has been fairly extraordinary. Thank you for pushing us to get to that level of access for specialty care. Next slide, please. And then a bit of a focus on Precinct 3. As was mentioned, and actually for the sake of time, I'm probably going to push through this a little bit more, but on the handout that you have, there are some specifics to the size of the patient population, particularly in need, as well as those who are living at or below that 200% of the poverty line that we were referencing below. So in important statistics, we are keeping a sharp eye on this, but for the sake of time, so that we have a chance to do more dialogue back and forth, I'm going to move on to the next slide, please. This center in particular, I just want to highlight, you will be able to access here, and we welcome you and your families here, family medicine, that is from newborns to geriatrics care. We have a women's health providers for our pregnant patients, also offering sexual health services, including prevention for HIV, as well as behavioral health, clinical pharmacy. We have a lab here on site, so you don't have to go off-site to have those labs drawn. And finally, for those who can't come into the clinic directly, we also offer telehealth services, both video and audio as well. Next slide, please. One of the other clinics, besides this one in this building, that is within this precinct is our clinic out of the Arch, downtown, where we serve predominantly the unhoused population. As a system, or as an organization, CommUnityCare has served over 5,000 individuals this year experiencing homelessness. The vast majority of those are uninsured, although different demographic population, only 17% of that population preferred a language other than English. Most of these services are provided either at the Arch or in a number of our permanent supportive housing locations. That's what PSH stands for. And that has involved many, many different partnerships with the city, with Integral Care, with the county, and many more. And the services also are of wide array. We try and meet all your needs in person, in the moment, whether we are meeting you on the street or whether we are meeting you at a shelter, whatever it may be. This has been a very, very robust program. A great deal of thanks to Central Health's Board of Managers and to the Commissioner's Court for help urging and pushing this type of unique service. This is an invaluable addition to the community. Next slide, please. Now, we have given you a bit of a picture of why we are here in the first place, an array of the different types of services, whether it is coverage, so everyone feels safe that they can come in and not have to risk their next paycheck just to get the medicines or screenings they need, and the wide array of actual clinical services we offer through both CommUnityCare and Central Health. I'm going to turn it over to Pat again to help us take a look into what the future holds for us.
All right, so taking us home into the Q&A. Thanks so much, Dr. Yagoda. Just a couple points around the expansion in the last few years. You all have this handout in front of you that has the colorful stuff on the front. On the back side, you will see the list of specialty care services that Central Health has developed together with our partners. There are a total of 30 specialty care services that Dr. Yagoda referenced that are listed out there. We've also expanded our clinical teams, including the providers that we contract with through MAP and Sendero, to about 11,000 different providers throughout the 8-county region that serve our patients. We've expanded the points people can access care. We created new health center sites in Hornsby Bend, Rosewood, Zaragoza, Del Valle. We're making substantial progress on our new care sites at Colony Park and our new headquarters and large multi-specialty site at the Sears Hancock Center right in the middle of downtown. We strengthened care for people experiencing homelessness through our mobile teams, our partnerships with EMS and community organizations, and the opening of our new 50-bed medical respite, where if you're experiencing homelessness coming out of the hospital, it's a place you can rest, recover, and heal, what many of us would do in our homes with a visiting nurse. We've made big investments in a more coordinated behavioral and mental health care system alongside our trusted partners, including Integral Care, and our patients are happy. So the results of recent public surveys show that the patients who actually use our combined Central Health services rank our care higher than any other healthcare provider in our community. I'll say that again. In a representative sample of 1,000 Travis County patients, representative in all the ways that statistically are validated in a survey like this, patients who have experienced care in our Central Health community care system rank our care higher than any other healthcare provider in our community. We recently had a patient come into our Rosewood Zaragoza clinic with a deep bone infection in his foot. He had actually walked from downtown past the hospitals that could have treated his infection, because he said, if I went into that emergency department and I tried to go in that emergency department, they sent me home. But I knew that if I came here to the Central Health Clinic, y'all would take care of me. And of course, we had to accompany him back to the hospital, and he wouldn't go unless we went with him and said, we will come with you and ensure that you get the care that you need. That's what trust in Central Health looks like, and it's how we know the system we're building is working. We have a lot more work to do, but we are on our way, and we're going to continue building it this way so that 10 years from now, following the visionary guidance of our Board of Managers, gaps in access to care, the various ways that Dr. Go described those gaps, delays in care, worse care because of the waiting, lack of prevention, that those gaps in care will be half what they are today. And the value that taxpayers receive for every tax dollar they bring in, we will be able to demonstrate $5 of economic value in return for every dollar in tax that we collect, a 5-to-1 return on investment for taxpayers or better. And we will be the most trusted and the most sought-after care provider in Central Texas. Folks will come to this area knowing that Central Health, our combined Central Health Community Care Sendero system, is really where you want to get your care for you and your family. And so with that, thank you for being with us tonight. Thank you for helping us shape that future, helping us build the path to get there. And with that, I'm going to turn it back over to Ted Burton to take us into the Q&A. Thanks, everybody.
Thank you. Thank you, Pat. Thank you, Sharon. Thank you, Nick. This is why we're here. We want to hear from you. The only slight ground rule is we'd like to invite everybody to ask a question. So if you've asked a question, give others a chance to speak. But now is your chance to speak directly to our CEOs and ask any questions you might have or provide any feedback that you might have. And I'm going to hold the mic, but I'll come to you if you raise your hand. Sam. And I'll hold it for you. I got it.
Thank you. Yeah, Dr. Lee, there's two questions, one related to Central Health and the other one related to Ann Howard and the commissioners. As far as being seamless, and we talked about the word seamless, it seems to me that you have MAP and then you have MAP Basic. And MAP is 6 months and MAP Basic is 12 months. And so if that is possible, I don't know the difference between the two, why, but if possible, if that could be seamless, if that could be both 12 months or so, retention might be more if you extend the 6 months to a year rather than having them two separate. And that to me is a little bit complicated, but anyway, my question is, I would request consideration for that.
Thank you, Sam. So just to break down what Sam has shared there, if you are on the medical access program under 100% of the poverty limit, every 6 months you have to re-enroll in the program, which is hard. You've got things going on. You may not know that you disenrolled until you try to access care and someone says you're no longer covered. Whereas in the MAP Basic program and our other services, enrollment lasts for 12 months. So we agree with you, Sam. We would change it today, tonight, tomorrow morning, if we could. But we cannot do that alone. Ascension Seed would have to agree to that change because of the nature of the agreement we have with Ascension. As the public knows, we are in a lawsuit for reasons like this to make sure that we can reduce these barriers to care and access. So that's a great point. We agree with you.
Thank you, Sam.
Ms. Howard, I have a question for, I'm not very familiar with the function of Commissioner's Court, but I've been doing a little bit of homework and I found out 4 commissioners and you have a manager and he doesn't have the veto power. My question has been the relationship between the Commissioner's Court and the city. If in the event there is a particular situation that occurs, either an emergency situation and so on, how does that work between the city? If, for instance, let me give an example. Let's say an entity that you're sponsoring decides to buy something and then or put it in their budget, and you approve that budget. And what if the city comes back and says no? Can they have a say so? If let's say, for instance, you have 10 hospitals and somebody wants to put in an 11th hospital, and the city says no, you can't do it. What happens if the budget's been approved? How does that work between Commissioner's Court and the City of Austin in relation to making that be something that works?
Thanks, Sam. I'm going to bring up Mike to you. Commissioner, do you mind stepping up to the podium? And as she's doing that, you have cards on your chairs, and if you would like to write a question and submit it, please do so, or I'll bring a mic to you.
Thanks for the question. There's very few items that are budget items that the county and the city have like crossover jurisdiction over. We have a lot of intergovernment ILAs. What do they stand for? Interlocal agreements. We have one with the EMS. How much is Travis County going to pay EMS to provide ambulance coverage? Okay, so if I wish that our hospitals, private, they're all private. I wish our hospitals all talked to each other and planned sort of holistically, but they loosely do that. They figure out, given their corporate structure, if they need another hospital. So I don't know if that helps you. There's a lot of planning and collaboration between city and county and central health and integral care, but this is a very unique thing where the county approves the budget for central health. And we work together all year long to make sure we do that.
Thank you. Other questions? Coming to you.
Thank you, Ted. And thank you, Dr. Lee, Sharon, and Dr. Yagoda. I just had a question about Sendero Health Plans. I was wondering how many stars that Sendero was rated. Just curious.
Thank you, Ahmed.
Do you need a softball bat with that one, or?
Appreciate you calling that out. Sendero is, the ACA plans are rated by CMS, and so Sendero is the only 4-star rated plan in the entire state of Texas. So, and we've held that for 4 years, Rudy? 4 years, 5 years running, 5 years running. So it has to do with the services that we make available and trying to make certain that our patients get the services they need, like preventative care, mammograms and colonoscopies, and those things help in that rating. So we make a lot of focus and effort to do that. So yes, we are the only 4-star rated in the whole state of Texas. Thank you for allowing me to point that out.
Can I brag about Sharon's team in a way that she won't? A Sendero Health Plan is a community health plan, and that really matters. They're not a commercial. Yeah. Technically, what does that mean, Sharon? You answer the technical question.
We're a nonprofit. We're supported by the Travis County Hospital District. You know, we're part of the central health, and we're not independently out here operating, you know, like a United, or not that United is exactly independent, but at any rate, you know. Does that answer your question?
And it means that nonprofit status and that alignment with the mission of Central Health means that Sendero's whole mode of operation has a different focus. They're not trying to drive a stock price or maybe extract every dollar or penny. They're really trying to create that customer experience to make sure that we reduce those barriers to care, that if we can, we authorize that medication or authorize that treatment. We reject very few. It's a completely different orientation, and it permeates all the way through Sharon, our senior leadership team, you know, to the folks who work on the front lines and respond to the calls that come in from providers or patients. It really has a different feel about it, and I think there's a joyfulness that I feel from the team at Sendero in working in that way. It's aligned with the mission of the health district, the mission and the well-being of our community. So I don't think it's an accident that it's the only 4-star plan in the Lone Star State for the past 5 years.
You will see a trend from our patients, from external auditors of our system, whether it's our patients and their exceptional preference for the Central Health Community Care Sendero system. They're telling us when we do a fully validated survey that we prefer you over any other healthcare provider in the region. CMS is telling us that this health insurance plan exceeds the expectations and the average that we would see in any other health plan. Community Care is awarded for being among the top 20% of health centers around the country. You will see this coming again and again and again, and it is for a very special particular reason. And Dr. Lee has alluded to this. It is because we have chosen to build a local payer-provider system where we literally sit around the table figuring out what are the most important things and how do we pay for it. This isn't about profits. This isn't about shareholders and making a buck. This is about doing right by the community. And it's because the community has put their trust in us through the tax base that funds care for those who don't have any other way of coverage. And so it's that commitment where we sit around the table together all the time, figuring out what are the most important things and how do we make them happen with the limited resources that we have. How do we show value back into the community that breeds a type of leadership, a type of, a set of priorities that is frankly unusual for healthcare in general. And the patients see it, and CMS sees it, and everyone else will continue to see it, and we're just getting started.
Thank you for that, Nick. I just want to add to what they're saying, because the reality of the staff, we don't do this by ourselves. I've got two of my staff here in the crowd. It's Karen Ader and Rudy Ibarra are here with me, and when we bring, I've worked in healthcare for years, and there's a certain population of people that are drawn to healthcare. They like working in it. They feel like they're fulfilled by it. And, you know, you'll find them working in hospitals, and sometimes people that have worked in healthcare have a hard time going out and building widgets. You know, it's just not the same. But there's something different within the central health environment with Nick's team and Pat's team and my team, is that they have a better concept of what we're trying to do. They get it. They know that we really are trying to help this population. And, you know, if they were in a big for-profit hospital system, it might necessarily be the same message. So we have a team of people, and they work for us, they work for Central Health, because they believe in what we're doing, and they're committed to us. We have very little turnover within Sendero. And, you know, we have a really committed staff of people who work really hard. We have, what was our re-enrollment, Rhodey, was 89%, is that right? 92. Oh, pardon me. Pardon me. 92% of our members re-enrolled last year. So we have a lot of continuity of re-enrollment from our members, and part of that is the staff. My point is, it's back to the staff that really believes in what we're doing and really cares for the mission here and stays with us and works hard. So.
Pat, I want to ask you a question. Commissioner Howard at the beginning mentioned that Central Health is the Travis County Hospital District, yet we don't own or operate a hospital. How is that different or similar to other major hospital districts in Texas?
Thank you, Ted. You know, we're in Austin, and we're keeping it weird. So this is the only hospital district in Texas that is built around a federally qualified health center. Why does that matter? Because if you want to prevent problems, you need to get your care out of the hospital. But in Texas, if you are a working adult and you're low income, there is no insurance for you. There is no source of payment for that care. In any other hospital district, especially between the big cities, there really just isn't a payer source to provide the income necessary to build a primary care system to care for everybody. But here, community care, as you saw, almost 100% of patients are low income. That's very high compared to other FQHCs. More than half are uninsured. More than 2/3 prefer a language other than English. These are very unusual numbers, and it's because community care can take care of Medicaid patients who are kids, pregnant women. They can take care of MAP patients who are poor working adults. They can receive Sendero patients, Medicare patients. In fact, they can care for everybody. So we are a hospital district that is very intentionally built around this FQHC structure, which means that we are able to actually braid the federal, state, local, and private funds together to have sufficient resources to provide a seamless healthcare experience for everybody. Right now, we contract for hospital services. We understand that in a future state, we will need to deliver those ourselves. And our board is actively thinking about that and how we do that. But ultimately, we want to create a system that has no edges. If you imagine a system with edges, once you reach that edge as a patient and you fall off the edge, you get hurt.
There, so I can see.
Or you might get backed up behind that edge in that long wait. You can get hurt. An example of that in our community, we spent about $300 million over many years to create a new and beautiful state hospital, Boston State Hospital. It looks much, much nicer. It has fewer beds than the previous state hospital, and it has a huge edge afterward. There's nowhere to go from that state hospital, nowhere to step down. And so 87 patients approximately out of 200 some beds have been admitted to that hospital for up to 11 years. They don't need to be there, but there's nowhere else to go. More than a third of the beds are blocked, and there's 1,800 people who need that level of care who can't get in. That's a system with an edge. And we have these edges all throughout our system. They could be data edges, they could be relationship edges, contract edges, care edges, and those bottlenecks prevent patients from getting the care they need when they need it in the right setting. And so what we're trying to build by being able to combine all these different kinds of funding is that system that's end-to-end and truly puts people at the center and can stay with them along the entire journey. Now, there's nothing about that that wouldn't be possible in Dallas or Houston or Chattanooga or Milwaukee or Los Angeles. So what we are creating here is potentially a model for one way that we can make healthcare work for the safety net population in our country. And that's part we're so excited about. What starts here sometimes goes on and changes the world. And so we are early in this process, but we have some early signal. Patients love the care they're getting. We're doing that part right. They love the coverage they're getting. There's something about our people who love working in this system. The mission feels real, and our patients love the care. So if we can hold on to those things as we scale this up, I believe we'll be able to track the value that we're delivering to taxpayers, and when we can do that at scale, we're going to have a model folks can be looking at around the state and around the country.
Thank you. Questions? Anybody? On committee? You ready?
Hi. I want to know if you have experienced any federal reimbursement problems, delay, or complications in the last few months with this federal administration, because I know you rely on those reimbursements from Medicare and Medicaid.
Great question, and thank you for asking. So at CommUnityCare, as Dr. Lee mentioned, a sizable portion of our revenue, our income, comes through our relationship with the MAP program of Central Health. But we do, more than a quarter of our patients are in Medicare, Medicaid, a smaller percentage in Medicare. So the turmoil in funding structures at the federal level have had us on guard. Fortunately, we have not had any disruption. Even during the shutdown, the government shutdowns, fortunately, the funding allocations through CMS and the other federal government agencies that we're affiliated with, their appropriations were allowed to flow during that period. So we have been very fortunate that we've been able to continue to receive the expected funding.
Sharon, could we continue on that line regarding what's happened at the federal level? And could you perhaps explain how that's impacted Sendero and the health insurance marketplace?
Yes, certainly what we saw was the ACA had tax credits that were not extended. There are tax credits, and then during COVID, the federal government extended the tax credits, and those were not renewed effective January 1st. there was a lot of concern that people would not renew. And I think we saw a lot of people, I mean, I think we saw a reduction, and I know we've seen a reduction statewide on people who have failed who did not renew. We've seen some that we think might have signed up for us, but may not actually end up paying. And they had to sign up by December 15th, or actually, I guess by January 15th, they had the option. And those members, some of them have paid, right, Rudy? Mike keeps track of that, but there are still some we think may have been waiting to see if the tax credits were in fact ultimately extended and might yet be prepared to pay, but they may not. So, I mean, we do see further changes coming. There are new regs that have just come out from CMS about changes in 2027 that are forthcoming, and they're going to give greater restrictions on access to how the whole plan works. So, does that answer your question?
And while we're on it, talking about what happens at the federal level and the impact here locally, Dr. Yagoda, this is for you. We get a lot of questions from the community, but specifically patients, regarding access to care. Would you address the fear that the community has regarding what's happening with ICE and immigration policies, and how the system, how Central Health, Community Care, and Sendero are responding?
Sure. Thank you for that question. This is a very touchy subject. As a health center, we are obligated by federal law to see anyone without regard to that ability to pay, and that's a real advantage for communities who feel vulnerable right now. We do not collect as part of our routine work anything about residency status, citizenship, et cetera. We have been fortunate that we have not had any visits on our premises of ICE agents doing searches. Although I will say we do partner with all law enforcement agencies to take care of the patients in custody. And that has involved some patients of ours who ended up in a detention center who needed ongoing care. So in fact, we find ways to keep the patients at the center of everything and continue to provide access under even the most extraordinary circumstances. The mere existence of that vulnerability for certain patients, we suspect has affected access to care. I think some may self-select out of going to routine care, but we don't have that data because we don't collect that data. But just through word of mouth, we have a sense that there is fear, and our message is that we will continue to provide access fully within the law, the state law, the federal law, and our doors are open without regard to anyone's ability to pay. Thank you.
Thank you. I'm going to continue on this theme, and then I'll let this one go. But Pat, this may be for you. Speaking of federal funding, what about our partners, other contracted organizations in the community that may be experiencing federal cuts? What's happening? What is your message to those organizations, and how is Central Health responding?
Thanks, Ted. Yeah, I think we are all aware that this is a period in which federal and some degree state funding is in retreat for a lot of the services, the social services that our community needs. And the city and the county and Central Health are three of the major taxpayer-funded sources of support. And all three of our organizations are feeling that as nonprofits lose key funding sources, they have to make decisions about whether or not to lay off staff or close services entirely. Last year, this challenge began. In the last fiscal year, Central Health had planned to expand our service growth by about $30 million. And we, at the guidance of our board of managers, cut that in half to about $15 million. And we found a way to turn some of the construction projects that we'd financed in cash to finance them in debt, to open up space to support our partners. That support, a lot of that went to our community care partners because there were decreases in Medicaid funding, pharmacy funding, and so on. A lot of it went to our integral care partners. This is the local mental health authority. And if we don't have mental health care, essential mental health services, then physical health certainly suffers. Patients end up in the jails, they end up on the streets. And so these were critical 24/7 high severity services that we had to maintain. And then we support a number of other partners like the HAM. Make sure our musicians were able to take that care. Foundation Community is a beloved partner that helps both get folks enrolled in care and get folks housed. And so we made sort of careful and intentional decisions trying to make sure that key partners could keep their doors open and the critical services that our community relies on could be sustained. This helps remind me to comment that the work that we do is interconnected and interdependent. We can't do this work alone. We have to work in close partnership. And so that discernment effort to try to understand what is on the sort of critical path to make sure patients get the whole person care they need, and what role do we have in objectively making some of those decisions and creating that funding support for the range of care that patients need for essential care. That's part of the challenge that we're discerning each year. This year, I know that our board is looking to create a dedicated policy to help us sort of explicitly do some of that discernment process, Ted, because the fact is the need that is uncovered by the federal funding loss and the state funding loss is far greater than we can sustain locally. So how do we make those difficult choices? But I'm really proud of the way that collectively our community came together last year, and hopefully this year we'll do the same.
Sure, you're allowed to ask a question, Sharon.
So at a recent Central Health Board meeting, I had the opportunity of hearing Commissioner Howard come talk to the Central Health Board about the program they have for diversion. And I think that is such a wonderful program that I would like you all to share that program with this group. And Commissioner Howard, if you want to come up and give your 2 cents on it, and Pat and Nick, but let them tell you about what they do in terms of mental health and diversion. So.
And then I have a question. Would you explain what diversion is?
I'll do that one first. So we're talking about diverting folks away from the justice system, away from jail, and into treatment, so that folks can get what they need when they need it from the right place to avoid the untreated mental illness that yields to crisis that in our community often leads to incarceration. And so we're working closely together with Integral Care, which is the organization that serves as our local mental health authority, with Central Health, with the police department, with the sheriff's office, the county attorney, the district attorney, really trying to coalesce around a better way of taking care of people. And so mental health, jail, diversion, and deflection before someone ever goes to jail or gets arrested, to try to help, sort of like your plan here of doing primary care, but to recognize this is a person in crisis, let's get them into care. You could talk to Selena all evening about work on the streets and the people that we're not meeting their needs, and we're spending a lot of money, and so we want to spend the money differently. And so that's what we mean by mental health, jail, diversion. It's not a new concept, but it's a catchy, it's popular right now because way too many jails across the United States are finding themselves as the largest mental health provider, which means provider of medicine, I believe, to treat mental illness. The jails are where that's happening. And so we're trying to change that picture and get people out of jail who are only there because of their untreated mental illness. So we're looking for the right place to build something, to partner with all those folks I just said, and to see how that fits into our continuum of healthcare, of mental health, behavioral health specifically, and just healthcare writ large.
Ted, could I build on that for just a moment?
Please do, and my mic's not working.
I just wanted to take a moment to acknowledge Commissioner Howard's leadership, Judge Andy Brown's leadership, the court's leadership on this issue. It's hard to get your arms around issues like this, and it's taken years of visionary focus and a lot of convening and gathering and creating a shared mental model across many different agencies. You know, one of the challenges we have is breaking through that noise and getting shared commitment to move an idea forward. And I think, you know, with the leadership of you, Commissioner Howard, and Judge Andy Brown and others, I think we are on the precipice of doing that. 40% of folks in our jails today are experiencing serious mental illness, 40%. And it is by far the largest site by volume for the provision of serious acute mental health care. So much so that if you were experiencing serious poverty and your child was suicidal, you'd have to actually ask the question, should I get my child arrested? Because then they'll get the mental health care they need. And I remember as a primary care physician, there was a time where if you were really poor, you might ask the question, well, should I go ahead and get HIV? Because if I do, I'll be cared for in a Ryan White supported clinic and I'll actually get good care. These are not the choices that make a lot of sense. No one would design it this way. But that is the problem that we have today. And so the opportunity to change that equation, to decriminalize mental health, to create a no wrong door where you can come in and actually get that mental health care, and we've got that continuum built, so depending on whatever level you need, we can get you there, and you can get cared for, and we don't punish you know, mental health illness or an addiction disorder. We treat these medical conditions with care. And so I just want to thank you, Commissioner Howard, and thank Judge Brown for your leadership and getting us right to the edge here, something amazing.
Thank you. Does anybody else have any questions? The good news is if you don't want to use the mic, you can use the card that's in front of you. We'll collect all of the questions and answer them and then publish them later, so this isn't your last opportunity. We also have 4 more community conversations planned for this year. I can't tell you the dates off the top of my head, but we have flyers, I believe, that we can share with you before you leave. Anybody have any questions before we offer our speakers the chance for final thoughts?
Ted, we have board directors and board managers
Yes.
who lead our systems with us, and I just want to offer the opportunity, would any of our board managers or directors like to offer some thoughts here, perspectives? Carol, please. Yeah.
Come on, guys.
Just come on up.
Does anybody have a question for us? Do you have a question?
A question?
Oh, question, okay.
You mentioned the CHAP for the chronic, the critical and chronic. Can you crosswalk that into the savings for the taxpayers? Because those people would be going to the hospital because of their chronic conditions. And you're offering them and you're paying the benefits. You're paying the premiums for them to have health care coverage to keep them out of the hospital. I know that is translated into dollars somewhere. So do you have a number?
Not off the top of my head.
Come on, Sharon.
Come on, Carol. I mean, I do think that we do know that these patients they're not inexpensive. I mean, you know, transplants are not inexpensive. And I think we've done something like 19 transplants of one sort or the other. We're talking kidney, liver, bone marrow. We also do things like CAR T-cell therapy. And we have patients that are on hemophiliacs, on really high-end expensive drugs that just, you know, these are the ones that fit into Pat's listing of people that die early. So we feel like that fits into that model. We don't, I mean, we are working on trying to quantify that. We have some numbers on how that fits together, but I mean, it's complicated because we do take care of these patients really are sick. And it takes a lot of initiative to try, and we have a lot of dialysis patients that are on chronic, long-term dialysis, but, you know, they also have a chance of getting a kidney transplant. So they're on that list as well, on the waiting list. So it's a great program, and thank you for pointing it out. Karen, can you tell us? Wait, give the mic.
It's not necessarily the dollars that we're saving. We're giving these patients quality of life they did not have before and a length of life that they possibly would not have. So extending their life and giving them that quality means a lot to our Sendero employees.
This is Karen Ader. She's my Chief Strategy Officer. And sitting next to her is Rudy Ibarra, who is our Vice President of Business Development, so part of my team here. So thank you, Karen. That's a really good point. Question right here.
I would just like to, share how grateful I am to see such a united coalition to approach the daunting tasks that we have ahead of us, not just the three CEOs of these groups that represent the hospital district, but also seeing our county commissioners working and really tackling, as Dr. Lee had mentioned, some very complex issues and bringing some visionary evidence-based thinking. And also today, I was just at City Hall seeing the same group, along with Integral Care, presenting to the Public Health Committee. It just feels like there is a united front in the face of the adversity that we're facing, which is finite resources. And, you know, at the end of the day, Central Health works to ensure that everyone in Travis County has access to affordable and timely health care, and that reduces hospital visits, ER wait times, and costs for both patients and taxpayers. And remember, that's often the same group, right? And I call that the dual bottom line. It's doing the right thing, and doing the right thing is dignity, care, quality of life, and length of life. We all deserve that. And it's also doing the smart thing, which is getting people to the right places they need to be and saving the taxpayer money and improving the experience for everyone in that process. And I couldn't be more grateful to be associated with a mission like this. So I really appreciate you all. Thank you.
Commissioner Howard, may I invite you to wrap us up? No? Okay. If nobody else has a pressing question, then Pat, I might turn it over to you to wrap us up. And as you step towards the mic, thank you to my magical staff. Upcoming community conversations, Thursday, April 16th, that's Precinct 1 with Commissioner Trevelyan. Thursday, May 14th, that's Precinct 4 with Commissioner Gomez. And then Thursday, June 11th, Precinct 2 with Commissioner Shea. And then we will be wrapping it up with a final community conversation that I don't believe is on the calendar yet with Judge Brown. So, sorry, it's not on my, July 30th. Thank you so much.
All right,
Pat.
so last up to y'all and home. Thank you, Commissioner Howard. Thank you, Constable Suits. Thank you to the Central Health team. So all the folks who stand on the periphery pulled this together. Let's just give a round of applause. I know these events are complicated, but you make it look easy. You make our jobs easy. Thank you so much. And most importantly, thank you all for coming tonight. This is your voter-created, voter-supported, taxpayer-funded system to make healthcare make sense. It doesn't make any sense that most of the healthcare, mental health care happens in the jail. It doesn't make any sense that folks on Congress Avenue who are human beings who need care, that there's no market to take care of them, but it's not free. We're all paying that cost. It doesn't make any sense that you gotta be seen in the ED, but then if the insurance company has to pay for that, they pass that on to the employers and the employees in your premiums, and the costs just keep going up and up and up with no end, so that we can't fund our schools and we can't fund our roads. And you know, this doesn't make any sense. And so what we're doing here in Travis County with your support is creating a system in which we fix that failure of the commons. We fix that tragedy of the commons. And and we provide the care that people need in the most obvious way. Start with the person. Start with that great customer experience that you typically don't feel in healthcare, but I believe many of our patients in CommUnityCare, in Sendero, in Central Health are telling us they are experiencing today. And so it's as simple and as hard as that. Let's bring this focus to the patient. Let's remove all those edges. Let's make great use of everybody's dollars, and let's show the world what's possible. So thank you all so much.
Thank you, Pat. Thank you, everybody, for being here.